Namaste and Siddhi Pranam. Welcome to your today's topic, which is guidelines for prenatal asanas, modification and contraindications. So, listening to our body is the wisest teacher, and practicing prenatal yoga with awareness and sensitivity is really essential during pregnancy, and it can provide numerous benefits for both mom and the growing baby. Yet, we need to look at the safety and prioritizing the comfort of mother should be our top priority. So gentle and modified yoga poses will help improve flexibility, strength, and bring lots of relaxation to the mother during the pregnancy period as well as during the postpartum recovery period. And the deep breathing exercises will enhance the oxygen supply to the baby and will also reduce stress for the mothers. And pelvic floor exercises will bring ease in the birthing process. So prenatal yoga basically promotes emotional well-being, reduces anxiety, and promotes sense of calm. Yet, when we look at the practice, it's really crucial to follow guidelines and avoid poses with contraindications to prevent potential risk. And then, so let's look at safe asana practice. So we really need to prioritize comfort and alignment for the mothers, and prenatal yoga has to be safe and an effective way to stay active during the pregnancy period, to make it healthy pregnancy. So the practice of yoga during pregnancy can be highly beneficial for both mom and the baby, yet it's crucial that it's approached with caution and mindfulness to ensure safety. Now, some of the valuable instructions when how to maintain proper alignment or prevent overstretching and prioritizing comfort and safety will be these. First, since pregnancy can make mother's body very delicate, then it also requires extra attention and care during all the physical activities. So safe asana practice are essential to prevent the potential risk, like we need to prevent any strain on the body, we need to look at that we are never overstretching and to avoid any kind of injury, and then we also need to prioritize alignment. So maintaining proper alignment is very crucial to prevent any kind of overstress on the body and to ensure the safety of both mom and the baby. And mothers should focus on their posture during yoga postures, that they are keeping their spine elongated and shoulders are always relaxed and hips are aligned. Proper alignment will help alleviate any discomfort, will reduce the risk of injury, and will also support with any changes that are happening in the body. Now, maintaining alignment during the postures will help the mothers to avoid any kind of risk, and also to maintain the posture, she should always focus that her back is not rounded or collapsing, the chest is not collapsed, and also she needs to lift her heart and gaze forward while standing in the postures. So just few small tips while practicing asanas will add a lot to the asana practice, and she can always use support of props to align the body and maintain good alignment during the practices whenever required. Now, we need to avoid overstretching because hormonal changes can cause the ligaments to become more flexible during pregnancy, and that then they are very susceptible to overstretching. So gentle stretching is really beneficial, but overstretching can lead to strains and sprains. So we need to avoid deep stretches that push the mothers beyond their flexibility limits. And also we need to opt for mild and controlled movements that will promote suppleness without compromising the stability. So here are some of the points that we need to do in order to avoid overstretching. So constantly guiding the mothers to listen to their body, and if they feel any discomfort, they should stop. And also we should not force into any pose. So guide the mothers while instructing for any posture, that they should not force themselves into getting into a deeper posture, etc. They should only bend or enter into the pose to a limit wherever they are feeling comfortable. And if she cannot get into a full pose, we can always modify for it the posture for the mother. And also, if she's not comfortable at all, she can come out altogether. And then we can also use props to support her body and also prevent any kind of overstretching. Then we need to emphasize the comfort and modification. So as the pregnancy will progress, the body's need and capabilities will change, and the mother will have to prioritize her comfort during the yoga practice. And this might involve using more and more props like boosters, blanket, blocks to provide support and reduce pressure on certain areas. And then we need to continue to modify the postures to accommodate the growing belly. And also we need to stop lying on the back after first trimester, which is essential consideration for safety and well-being of both mother and the body. And we need to guide the mother constantly to keep listening to her body and keep connecting to herself intuitively. That's more important, because she will only know how to respect her body and how to respect her body's limitation, and also respect the feelings of any discomfort, fatigue, or strain. If the pose doesn't feel right, then it's not right. So the key to find balance between pushing oneself and recognizing the body limits is very important. So safe asana practice are utmost important to ensure the well-being of both mom and the baby. And when we prioritize alignment, avoid overstretching, and also emphasize comfort and emphasize on listening to the body, we can make the practice more enjoyable and beneficial for the mother while mitigating the potential risk. Now let's look at modifying asanas for pregnancy. So during pregnancy, mothers experience a lot of physical and hormonal changes that might require special attention during the yoga practice. So there might arise a need to constantly modify even the smallest basic practice. And then we need to really accommodate to the changes that are happening in her body. For example, in the standing poses, a simple posture like Tadasana or mountain posture, we should allow her to stand a bit or creating a slight space into her feet if she requires, and if that helps her aligning her body and bringing more centered and groundedness. So she can actually ground herself a lot more and take her own time to ground into the mountain posture as compared to in regular practice. And then when she can, even if she wants, she can close her eyes for a while and stay there. And or she can, and then there are some women who might not feel comfortable at all in closing their eyes. So just to stay focused and keep finding the balance. So different practitioners might feel differently, and a simple practice as like mountain posture can also be modified. Now, when it comes to triangle pose, we can use more of blocks right in front of us, and we can place or take the support of the wall also. And then we might need to modify other asanas, other standing asanas also accordingly as per the needs of the growing belly. And we can use more of blocks and walls, especially while practicing standing asanas to support the weight of the belly and the baby as well as the growing body. Now, during the seated asanas, longer sitting for extended periods can be uncomfortable for mothers, so they can use boosters or cushion to elevate their hips. That will reduce the strain on their lower back and pelvis area. And for example, and then in coming to seated forward bends, we can adapt to different stages of pregnancy in the forward bend, and we can adapt by separating the feet a bit wider then the hip width apart, and then bend from the hips rather than from the waist to avoid compressing the belly. So seated postures can be done throughout the pregnancy. However, it's really important to listen to the body and modify the postures as and when required. When it comes to twists, mothers should perform gentle twists to avoid excessive pressure on the abdomen, and they can place a block or a cushion behind the back to support and twist from the upper back instead of the belly. So this is the focus that they need to maintain, always a twisting from the upper back and not from the belly. So twists can be practiced throughout the pregnancy, but one needs to avoid deep twist after second trimester. If the mother is practicing the twist, we need to ensure that her core is engaged and the spine is long. And then when it comes to back bends, mothers should perform gentle back bends to avoid strain on the abdominal muscles. They can place their hands wider and lift the chest moderately to maintain comfort and safety, specifically in the camel posture. And back bends can be practiced throughout the pregnancy, but one should avoid deep back bends after the second trimester. If one is doing back bends, then we need to ensure that the core is engaged and the spine is elongated. And we need to support when with the back with our hands, specifically in camel posture, to support the balance of the body. Then coming to supported bridge pose, to prevent the strain and support the lower back, mothers can use a block or a booster under the sacrum while lifting the hips gently. When it comes to forward bends, they can be practiced throughout the pregnancy, yet we might want to avoid deep forward bends after second trimester. If mother is practicing that, then we need to ensure that the spine is long and we are using support like chair or wall, etc. And then supine postures after the first trimester, lying down on the back might restrict the blood flow to the baby. So mothers should stop lying down on their back, and they can lie down on their sides with a pillow or booster in between their knees to support their posture. And then inversions. So legs up the wall, the Vipreet Karni is really fine. So full inversions are best avoided during pregnancy, yet only legs up the wall pose, the Vipreet Karni, can be practiced. So this will improve circulation and reduce swelling in the legs. So rest other inversions should be avoided after the first trimesters. Now, when it comes to specific recommendation, then in first trimester, we need to focus on gentle postures and promote relaxation and flexibility. We need to avoid postures that put pressure on the belly or back. And then we need to continue to modify as and when required based on a particular medical or physical condition of a mother. In second trimester, we need to start incorporating slight challenging postures into the practice, but we still need to be sure that the mothers are listening to their body and not putting extra pressure or not overdoing anything. We need to avoid deep twists and back bends during this stage. When it comes to third trimester, we need to focus on posture that promote relaxation and comfort, and need to avoid the poses that put pressure on the belly or back, and then we continue to modify as and when needed. Then practices or postures, practices that we need to avoid in the first trimester would be rapid pranayamas. So rapid pranayamas include Kapalbharati, Bhastrika pranayama, or breath of fire. All these fast-paced pranayamas that can generate more heat in the body. We need to avoid those fast-paced breathing exercises, as they might cause dizziness or hyperventilation, which is really harmful during pregnancy. Then we need to stop straining the abdominal muscles. Poses that involve excessive abdominal contractions or straining should be avoided, as they can increase the risk of miscarriage. Now, deep forward bends with legs together can compress the abdomen and put pressure on the uterus, which is not recommended during first or any trimester. And any poses that require lying on the stomach should be avoided, as they can cause discomfort and restrict the blood flow to the uterus. And twisting postures that involve deep twists should be avoided, as they can strain the abdominal muscles and potentially disrupt the implantation of the embryo. And also any postures that causes discomfort or stain should be avoided. And then we can keep continuing to modify as and when required. And then comes to second trimester. Then the precautions of the first trimester should be followed as it is. And while some poses may still be safe for the practice, then yet modification and awareness becomes increasingly important during this time. So it's really essential to avoid any strain and any practice that would bring the mother into discomfort. Now, we need to focus on gradual resumption of fatigue. So while it's natural to feel more energetic during the second trimester, we need to avoid overexertion and also listen to the body's cue and gradually resuming physical activities if someone has, especially if the mother has experienced a lot of fatigue during the first trimester. Now, we need to completely avoid lying on the back after 4th month, and lying flat on the back after 4th month can really compress the vena cava, which is the major vein that returns blood from the lower body to the heart, and this can decrease the blood flow to the uterus and might cause dizziness or discomfort and harm to the baby. Now, avoiding the postures or practices that are during the second trimester. So certain yoga postures can become risky and should be avoided in the second trimester. First is upward dog. Poses that involve lying on the stomach and arching the back should be avoided, and this can cause discomfort. Deep back bends without proper support can strain the back muscles and potentially cause injury, especially pregnancy, as the pregnancy will progress. Inversions, the pelvis is really higher than the head. Inversions in which the pelvic is really higher than the head should be avoided, as it will increase the risk of dizziness, fainting, or falling, which can be really dangerous. And twisting postures where deep twists are involved should be completely stopped at this point in time, to not to potentially risk the blood flow to the uterus. And then avoiding lying on the back to avoid any discomfort to the mom and the baby. And then as the body will change during pregnancy, so attempting new and challenging arm balances can also increase the risk of injury. So we need to stick to familiar and safe postures. Then, as discussed, we need to stop the supine posture, holding on to the supine postures for long, as the vena cava can be pressed, and this can slow down the blood flow and oxygen flow to the baby, and this can be dangerous. So if the postures require particular posture, for example, in the picture you can see this posture is usually not done by the pregnant mothers, but if there are postures that require her to lie down on the back, for example, happy baby pose or Pavan Muktasana, gas relieving pose, which she can do partially at that point in time, then we need to ensure that she is not holding longer in the supine postures. So even if some postures are fine for a few seconds, just to relieve some back pain or back discomfort, but we should avoid lying down for longer periods, like in Shavasana example, for example, at the time especially after second trimester. Then coming on to the third trimester, as the pregnancy enters the third trimester, it's really more important to maintain earlier precautions and make additional modifications that are needed. So the growing baby will change the body's balance and will increase the risk of complication. So we need to maintain the earlier precautions and continue to avoid the posture that strain the abdomen and risk the blood flow to the baby and belly and or cause any discomfort. We need to modify the practice as needed to accommodate the changing body. Now, as the pregnancy will progress, we may need to modify a lot more and use the props a lot more and adjust the body's alignment a lot more. And also, we need to make the mother more intuitive in the sense that we need to let her know again and again to listen to her body's cues and listen to the body's discomforts and comforts, and whatever is causing discomfort, she should immediately come out of the posture. Now, as the baby will grow, the position of the baby might shift, which will affect the balance and comfort of certain posture. So she might change so rapidly that in the class, the asana that she was able to do 2 days before in a class, she might not be suddenly able to do it just after 2 days. Because when the baby shifts, the balance of the weight also shifts in the body. And certain asanas thus can become comfortable or uncomfortable suddenly. So that's why the modifications will be quite rapid, specifically in the third trimester. Now, let's look at the postures to be avoided during third trimester. So as the body will undergo a lot of changes, we need to keep modifying. And for example, downward facing dog might not be suitable for everyone during third trimester, especially if they have special conditions, certain conditions like high blood pressure or pelvic pain. So we need to modify accordingly. We can always use a chair to get a similar kind of stretch that downward facing dog gives. So for most women in third trimester, supported downward facing dog with a chair or a wall can be done. With chair, it's better alignment. So using it and practicing it with a prop or a support is far better than just suggesting the raw downward facing dog. And then is wide leg forward bends. So deep forward bends with wide legs can strain the pelvic muscles and may be uncomfortable during the third trimester. So we need to modify these postures or avoid them altogether. Then we need to avoid breech baby postures. So poses that encourage the baby to be in a breech position should be avoided, as they can increase the risk of complications during delivery. And then we need to respect the discomfort and continue to respect the limitations of the third trimester body. And if a pose doesn't feel right, then we need to skip it and modify to suit the needs. Then unique situations. So when not to exercise. So while yoga is beneficial, yet there are certain situations where it may not be safe to practice yoga also at times. So it's really essential to prioritize the health of the mother and the baby. So some of the circumstances in which we should avoid is, first, if there is a risk of preterm labor. If the mother has history of preterm labor or is at risk of it, then we need to avoid strenuous asanas practice that can trigger potential contractions. And if she still wants to practice, then she can get a medical clearance from her doctor. If there is a case of vaginal bleeding, and if she's experiencing vaginal bleeding, then we need to refrain from any kind of exercises, including yoga, and we need to seek immediate medical attention, because asanas or exercise at this point in time can increase the bleeding and can be an indication for more serious underlying issues in the pregnancy. Then in cases of premature rupture or membranes, if the water breaks prior to 37 weeks of pregnancy, we need to avoid exercising and seek medical attention immediately. And then in this case, any kind of workouts or exercises in this situation can actually increase the risk of infection as well as other kind of complications. So when we look at the contraindicated postures during the pregnancy, some postures are contraindicated, and these poses can put unnecessary strain on the body. So it's really essential. First is deep twist, postures that involve deep twisting and should be avoided. And these twists, because twists can put pressure on internal organs and compress the uterus, and also might affect the blood flow to the baby. Alternatively, only gentle seated or standing twists that focus on upper back rotation and shoulder can be practiced instead. Seated twist is a great pose to improve digestion and relieve back pain, so it can be included into practice. And then we need to focus on postures like back bends, where deep back bends can actually strain the abdominal muscles. So we need, and they can actually put pressure on the front of the uterus, and they can also cause high blood pressure. So back bends can put a lot of strain on the spine and cause backache for the mother. So alternatively, we can practice gentle heart opening postures like cat-cow or modified camel pose, and with a focus on opening the chest and upper back. All these gentle postures can really help improve the spine flexibility and ease back pain. Then come inversions. So as discussed, inversion postures where the head is below the heart can disrupt the blood flow and can reduce the blood flow to the uterus and the baby. So it's best to avoid inversions altogether. Alternatively, we can choose wall-supported or restorative postures with legs up the wall for similar benefits without the risk. Then comes deep forward bends. So in third trimester, forward bends can put pressure on the cervix and increase the risk of preterm labor. So if the mother is in third trimester, it's best to avoid deep forward bends. And extreme forward folds can compress the belly and lead to discomfort. So alternatively, we need to opt for standing or seated forward bends with wide-legged stands to accommodate the growing belly. The child pose is great pose to relax and release tension, and that can also give similar benefits. Then is high impact postures, where the high impact postures which involves sudden jumps or jarring movements, all of that should be avoided during pregnancy to prevent any stains and injuries on joints and ligaments. Alternatively, low impact movements like gentle flowing sequences or modified sun salutations can be practiced. You can also opt for low impact exercises like walking and gentle walking meditations, etc., if the mother is not in a condition to practice asana at all. So all the gentle walking and even swimming can have similar cardiovascular benefit as like yoga, and do not stress the body as much as compared to workouts or certain yoga asanas. Then coming to the supine postures, so lying on the back for extended time can reduce the blood flow to the baby. So alternatively, we can use postures, props to elevate the upper body, or practice sideline postures to ensure proper blood circulation to the uterus. Then poses that involve intense abdominal contraction might cause discomfort, and these kind of poses can put excessive strain on the abdomen. So we need to avoid lying flat on the back after first trimester to ensure the safety of both mom and the baby. And we need to focus on gentle core strengthening exercises or breathing techniques like belly breathing. And then hot yoga or hot room practice. So high temperature and excessive sweating can lead to dehydration and overheating. So alternatively, during pregnancy, it's actually safe to opt for regular or well-ventilated room rather than hot yoga practice, because this can lead to overheating the body, which might pose a risk to the baby. And choosing a comfortable environment to practice yoga during prenatal phase is very essential and crucial for the health and safety of both mom and the baby. So let's look at the alternative safe options. Some of the alternative safe options to be practiced would be, let's say, semi-reclining postures, where we can use props like bolsters or pillows that can provide support to the upper body while lying semi-reclined. And this position can help elevate pressure on the abdomen and also provide gentle stretching to the spine. Now, side-lying postures, we can lie on the side to prevent compression on the vena cava nerve, and side-lying posture can be modified with props and for adding more comfort and support. We can elevate our legs, so we can lie on our back with our legs elevated on a bolster or a cushion to improve circulation without compressing the vena cava. This position can help reduce swelling in the legs and also feel more comfortable during pregnancy. And then supported bridge pose. So we can use props like blocks or bolsters to support the lower back and the pelvis in the bridge pose, and this can help reduce pressure on the lower back and also sacrum while providing a gentle stretch to the spine. And then seated and supported postures. So we can sit on a chair or use cushions to support during seated postures to maintain stability and also reduce strain on the pelvis and the lower back. Supported posture can also be practiced against the wall to add more support. Then hands on knee postures. So practicing the postures on hands on knees can elevate pressure from the vena cava nerve and can prevent strain from lower back. So we can use props as and when needed to support the wrists and the knees for added comfort. Then wall standing. So we can stand near a wall to support and balance during the standing postures. This can help reduce risk of falls and also provide stability as the body's center of gravity is shifting. Then protecting the joints and preventing overstretching. So it's really important that joints are protected and we are avoiding overstretching. So we need to avoid bouncy movement. So we need to perform only those yoga movements with smooth and controlled motions to prevent any kind of injuries, and also we need to avoid any jerky movements that can put strain on the joints. And then we need to be mindful of the hormonal shifts, as hormonal shifts during pregnancy makes the mother's body more susceptible to injury. So when we are mindful of her body's limitation, we will avoid pushing beyond her comfort zone. And also we need to be cautious with relaxing. While relaxation is really important during the prenatal yoga practice, but we need to maintain stability in the joints to prevent future problems. So we need to avoid sinking into postures excessively and focus on maintaining good alignment. And then monitoring the heart rate during a pregnancy exercise. So any kind of workout, exercise, or even extensive yoga during pregnancy do require careful monitoring to ensure the safety of both mom and the baby. So when we look at monitoring, then heart rate is very crucial here. So first, what we need to see is that we're not putting any kind of additional strain and hence not increasing the heartbeat of the mother. So pregnancy does increase a lot of overload on the heart already of the mother. So if she's feeling that her heart is beating faster or heart rate is increasing and she's exerting herself too much, then she needs to stop immediately. And then overexertion should be avoided. As I said, we need to really prevent the strain on the body that is causing excessive fatigue, or excessive breathlessness is also a sign of increased heart rate. So we need to modify the intensity as needed to maintain the comfort level of exertion. Then we need to ensure the intensity of our exercise is suitable for the pregnancy. And if we are unsure, we really need to ask the mother if she's feeling comfortable or not, as many as time required. And if she continues to experience higher heart rate, then she immediately needs to consult the doctor. Now, when to consult the doctor, in which situation? So, although it's really safe to practice yoga, but there are certain times when we need to consider that one needs to see the doctor immediately or whenever required. So first, teachers, as a teacher, you should encourage the mother to consult doctor before participating in the prenatal yoga classes. This will ensure that any specific medical concerns or conditions are addressed appropriately. And each pregnancy is unique, and so individualized guidance is really essential, especially for the mothers who are having pre-existing medical conditions or complications. So consulting with a doctor or healthcare provider will allow for personalized recommendations also that are tailored for mothers' specific needs. And then healthcare approval. So doctors can provide whether clearance, whether prenatal yoga practice is safe or not for a particular mother, based on her medical history as well as current health status. So this approval will help ensure that the mother can safely engage into yoga practice without putting herself or the baby at risk. So by consulting the healthcare providers, mothers can really receive the necessary clearance and guidance to participate safely into the classes and ensure their physical and emotional well-being. Now, using props to support the prenatal yoga class. So using props during yoga class is especially important for the mothers, as it can continue to offer additional support and comfort during their pregnancy journey. Props like bolsters, blanket, and blocks can be really beneficial in many ways, and props can really help the mothers to get most out of their yoga practice and can make it more enjoyable and accessible. They can also help her to explore new postures and variation that she might not be able to do without them. So, as the pregnancy will progress, the body will go through a lot of changes and the belly will grow. So props can really help provide support to the growing belly in various asanas, and it can ensure comfort and stability, and also ensure that they are not putting excessive strain on the body. Some props can also help in the alignment, and this will be helpful in preventing strain and injury. And props can also assist the mother in maintaining the center of the gravity as the balance, because the center of the gravity is shifting, so she can balance the weight with the help of the props. And props also help relieve pressure, as pregnancy does bring a lot of discomfort and pressure in certain areas like lower backs, hips, and pelvic region. So props can be used strategically to relieve the pressure and promote relaxation during the practice. And then mother also need to constantly modify a lot of postures to accommodate the changing needs of the body. So props can be employed to adapt to certain postures and make sure that they are more accessible and safer during pregnancy. As her body also is going through a lot of hormonal changes, which is affecting her joints, ligaments, and also stability and balance. So props can also offer additional support in creating that balance and also reduce the risk of injury and provide a sense of security. And then since pregnancy is also physically and emotionally demanding, so restorative practice using props like bolsters, blankets, and cushions will provide essential rest and support and comfort during the pregnancy, and which will be more easeful for the mother and allow her to connect to her body deeply and connect to her all the challenges that she's facing in the day-to-day life, allow her to release that during the restorative yoga practice. Boosters can be placed under the knees during savasanas to elevate leg and ease pressure on the lower back and also promote circulation. So in seated posture also booster can be put behind the back to provide extra support and also prevent slouching. Blankets can be folded and used as cushions to sit on and elevate the hips and maintain more comfortable seated position. They can also provide cushioning and support for the knees in kneeling postures, and blankets can also be used to provide warmth and support, and you can also use them as a prop for the hips in poses like child pose to support the back in the seated postures. Blocks can be placed under the hands in standing poses to bring the floor more closer and to ensure stability and proper alignment. And they can also be utilized for modified version of poses like half moon pose against the wall, or balance the downward facing dog, or to support the weight in the poses like warrior pose, etc. So then we need to personalize the practice. So every mother's experience and needs are unique, and therefore props can be utilized to suit the requirements individual requirements. So yoga props do offer that versatility that will allow the mothers to explore the practice more safely and comfortably. Now let's look at the sequencing for specific needs. So we can customize the prenatal yoga practice in a beautiful way to address the specific needs of the mothers. And these sequences can focus on relieving common discomfort and promote relaxation, and also prepare the mother for childbirth. By designing practices that are safe, effective, and nurturing, prenatal yoga can be made more empowering experience for the mothers. So, for example, we can design sequence for relieving common discomforts, many pregnant mothers, like hip opening. So many mothers do experience a lot of discomfort in their hips and lower back. So sequences that incorporate hip opening postures like pigeon pose, butterfly, etc. Can actually alleviate tension and improve flexibilities in the pelvic region. And some of the poses that can relieve the common discomfort during pregnancy would be soothing back stretches. So to relieve back pain, cat-cows and child pose, and also a lot of we can also create slight flow in the cat-cow, etc. All of these can be added to release the tension from the back. And then we can create this class sequence around balancing, and this will improve the stability, and the sequences can feature postures like tree pose or warrior pose and focus on grounding and alignment. And then we can also create a class around promoting just relaxation, which can incorporate restorative postures like repeat karni or butterfly posture with help of postures, and also we can add a lot of yoga nidra to it, calming breathing practices, deep belly breathing, etc. to encourage deep relaxation and reduce stress, and also calm the mind and body. And We can also introduce breathwork exercises like square breathing and also deep inhales and exhales to enhance the relaxation. Yoga Nidra can also be included at the end of the sequence to offer profound relaxation and promote better sleep. And then preparing the body for labor and childbirth. So creating a sequence specifically for labor and childbirth can also be a great idea. And if the class is for pregnant mothers in their first trimester, we can just focus on maybe relieving common discomfort at that point in time. But if the class is for women in their third trimester, then we can certainly focus on preparing for labor and childbirth. So it's really important to choose postures that are appropriate for the participants' level of experience as well as stage of pregnancy. So if the participants are more experienced, then we can give slight challenging posture. Otherwise, we can see that that it's comfortable for all in the class. So finally, it's really important that mothers are guided to listen to their body constantly, and if they are feeling any pain or discomfort, they should come out of the posture immediately. And it's also important to take breaks throughout the class, and it's important to keep including pelvic floor awareness exercises or asanas into the practice. And it's important that we keep preparing the body for the labor postures through squatting postures, as well as squatting postures, as well as pelvic floor asanas. And then pelvic circles can also be added to help with improving the flexibility and the pelvis. And it's also beneficial for the labor practice. And we can continue to add breathing techniques and continue to teach different breathing techniques to the mothers, like Ujjayi Pranayama or deep belly breathing, to cultivate breath awareness and also prepare them for the coping strategy for labor. So sequencing can be really customized to allow and address specific needs of mother, to offer relief and for common discomforts and promote relaxation. And by incorporating gentle postures and breathing exercises and relaxation constantly, we can really make this practice very fruitful for the mothers. And when we personalize the practices, they will provide physical benefits, but also will create a nurturing space, and emotionally nurtured and physically nurtured space will create more sense of trust and safety within the mothers, which will be certainly beneficial for not only her but for the baby also. And at the end, we need to always consider the health and safety of both mom and the baby, and just focusing on the limitation and understanding whenever her needs are changing, we need to change our practice and suggestion also at the same time. I really hope this helped you and this contributed to your understanding, and you will contribute to many lives through this. With that, thank you and namaste.